This is TVC News. We'll take you back now to our correspondent in Ghana, Eunice Jare Orchere. Eunice, I asked earlier, this situation on ground at the moment, how bad is it now that the doctors have resolved to continue with the strike?
Well, pressure still continues to be on the private hospitals and then the police and military hospitals across the country. A few deaths, some deaths have been recorded across the country, and these have been attributed to the escalation of the strike action. There are still people who cannot afford the government hospitals, the private hospitals, so are waiting at the public hospitals, just hoping that someone would attend to them. What we understand is that the government is likely to re-engage some retired doctors to take over, at least to limit the impact of the strike. Some retired doctors have expressed interest in volunteering their services, so we look forward to we look forward to that. I had a meeting yesterday that it was Friday. About 213 doctors voted for the action, but we understand that about 148 voted for them to resume duty. So we can see here that not all are in favor of the strike action declared by the Ghana Medical Association. At the moment, government still maintains its position that the strike is illegal, and that per the labor laws, an employer cannot negotiate with an employee while the employee is on strike. So this is what they've been contending with for a while now. Government is pleading with them to get back to work so they can get back to the negotiating table. We understand that government will soon communicate its next line of action, perhaps today or tomorrow. We will keep an eye on that. But for now, the struggle continues. Pressure is still on the private hospitals, and the pressure is expected to increase as the days go by.
All right, you say that the government, the authorities are saying that the strike is illegal. Are there no efforts at all to ensure that both sides reach a middle ground to resolve this?
Well, the Fair Wages and Salaries Commission has been asked to do this. So even though the government maintains that it is illegal, they're still going ahead to still do a bit of talking with informal talking with the leadership of the Ghana Medical Association, even though many have said that it is a breach of what the law actually says. But the government says that it has to perhaps bend the rules a little to see if they can come to an understanding. So there has been a bit of talking here and there, but then I think what they're saying is that proper negotiations cannot resume until this is done, until the doctors return to work. Several bodies have appealed to the doctors. There's still a bit of talking going on. Fair Wages and Salaries Commission is doing some talking. The Ministry of Health is also doing some talking with the doctors. But what we know is that proper negotiations on the conditions of service proposed by the doctors cannot resume until they get back to work.
All right, what about the concern that was raised by the doctors about, telling the government to very clearly spell out their conditions of service? Is anyone responding to that?
These have been, in fact, talks actually started. What the government is saying that some of the, I remember I think I earlier gave out some of the conditions proposed by the doctors. Some of them government has approved, but others government says there would need to be some thorough financial analysis because, of course, they will have some implications, a lot of implications on the country's economy, which is already not in a very good condition. Some of the requests have been described as outrageous and would really weigh down on the country's economy. So those might need some time to consider. So some have been approved, others need more talking to be done, perhaps for each party to understand details. But then others, we are not yet sure what's going to happen to others because of their supposed financial implication on the country's economy.
All right, how much of a challenge do you think this is to the Monetary Fund program in Ghana?
Okay, please take that again.
I said, how much of a challenge do you think that this strike is to the Monetary Fund program in Ghana? All right, we seem to have lost our correspondent there, Eunice Ochre. Thank you very much indeed for your time.